This is the VOA Special English Health Report. President Obama has signed legislation to make the biggest changes in the healthcare system in 45 years. The president said, "Today, after almost a century of trying, today after over a year of debate, today after all the votes have been tallied, health insurance reform becomes law in the United States of America." Many parts of the plan will fully take effect in 4 years, but some take effect quickly. For example, in 6 months, the new law will bar insurance companies from denying coverage to children with pre-existing health conditions. Adults with pre-existing conditions will be added in 4 years. The government will help millions of people pay for insurance. It will also permit millions more to receive free coverage through the Medicaid program for the poor. In all, the plan aims to make health insurance available to 32 million people now without it. People will be able to buy private policies through marketplaces called exchanges to be administered by the states. Illegal immigrants will not be able to take part. An estimated 83% of people under age 65 who are in the United States legally now have insurance coverage. The plan is expected to raise that to 95% within several years. People over 65 are covered by the Medicare insurance program, which the government created in 1965. For the first time, Americans will be required to have health insurance or face a yearly fine starting in 4 years. The law will also require companies with more than 50 employees to offer coverage. If not, they could face a fine of $2,000 a year for every worker. Also, this year the law will start closing what is known as the donut hole. That is a lack of Medicare coverage for some drug costs for older Americans. President Obama promised senior citizens that the reforms will not cut their guaranteed benefits. The Senate quickly made a last set of legislative fixes needed in the new law. However, some states have already gone to court to fight the new health care reform law. The health care plan is expected to cost about $940 billion over 10 years. But it is also expected to help reduce the federal budget deficit. And that's the VOA Special English Health Report. You can comment on this story at our website, voaspecialenglish.com.